Hi, guys. Thanks for joining us on the Activate and Illuminate podcast with Mel. I'm your host, Mel. Together, we're going to be diving into some stories of ordinary people doing a little bit of extraordinary things. People who've maybe pushed their bodies, their mindsets, or maybe society's paradigms. So you're going to find yourself maybe wanting to laugh, cry, or even be inspired. We would invite you to share, like, and subscribe, to sign up for our newsletter as well on activateandilluminate.com. Now, just keep in mind that this information that you are going to hear is informational and educational for entertainment purposes only. This does not constitute professional advice of any kind. The views expressed are those of myself and guests only. Listeners are encouraged to seek professional and legal advice regarding their own situations. So, thank you for joining us. We appreciate your time, and thanks again for being here. Hi there. If you're listening with us today, you are going to have a treat in Dr. Debs Eastwood out of the UK. So she is an anesthesiologist who has created a community called Wellness on Tap. And she does something a little bit different in the operating room that quite fascinated me, and I think it might you as well. So have a listen, Dr. Debs, and we'll also share with you at the end how we actually have a few things in common and we have some passion projects together. So stay tuned. Hello, everyone. Well, today I am joined by Dr. Debs Eastwood out of the UK, and I'm so excited to talk to her. She has a wealth of knowledge, and we're just going to get right into it, Dr. Debs. So tell us a little bit about yourself, and we'll go from there. Yeah.
Sounds like a good a place as any to start. Thank you, Melanie. So, yeah, I'm Dr. Debs Eastwood, UK born and bred. Don't have a very strong Yorkshire accent, which is where I'm from, because my mum used to teach lip reading, one of the many things that she did. And so she wanted me and my little brother to enunciate our words clearly so they could be lip read. So, but get me in a room full of fellow Sheffielders and yeah, the accent comes out.
So tell us a little bit about, you are an anesthesiologist in the UK, but you've taken a little bit of a different approach. You are, specialized in a few other extra things. And tell us about what you're participating in now, and then we'll get into some of those conversations.
Okay. So shall I tell you first about my journey into anaesthetics so that you can understand where I came from? Okay. So as a teenager, I was exceptionally rebellious. I must have been a bit of a nightmare for my parents. Again, straight away, not the typical route into being a medic. My mum was the qualified one. She had a teaching degree that she used initially for young children and then went out into teaching sort of deaf, blind, multiply challenged young individuals, and then eventually into adults. That's a story in its own right. But I unfortunately lost her when I was only 20. And that was a pivotal point in changing the direction of my life. So I'd already been thinking, I need to do something with my life. And when she passed, I lost not only my mum, but she was like my big sister, my best friend. We were really, really close. And I thought, well, I need to do something now to make her proud. I'd already made a start and gone back to a college, which is normally for 16 to 18-year-olds here in the UK, even though they do offer a lot of adult education classes. So I was already thinking about it, and I got myself into university after the college course and read for a degree in anatomy and cell biology. And then during that, because I can never do one thing at a time, I decided to get married and have my first child, my little boy, who's fully grown up now. And so when it came to the time when I finished my degree, a lot of people would be going into working in the labs, the biochemical labs in hospitals and things like that. And I was like, I don't want to do that. That just sounds so dull. So what can I do? And the prof that I was with at the time, he had spent many years of his life, probably about at least 20, maybe 30 years of his life. He was an English-born chap, but living and working and getting married and raising a family in Philadelphia. in the US. So he was relatively new back to the UK, certainly new to the university. And he said to me, well, I've got all of these different projects that I want to complete. Do you want to stay and do some of those with me? Well, I got childcare. I needed to stay in Sheffield, or rather it was more convenient to stay in Sheffield in my home city. So I said, yeah, I think so. I says, I don't really think lab work's for me for my entire life. I said, but yeah, that'd be great. He said, well, I'll make it into a PhD project for you then, if you'll stay. He was almost trying to sell it to me, bless him. So that's the rather unusual route that I ended up doing a PhD, which was the posh name is Human Testicular Germ Cell Tumours and How They Caricature Early Human Development. I know, get your head around that. Basically, it's in human stem cells, which are very interesting at the moment. But that was a long time ago, nonetheless. So I'm not saying that I'm up to date in that, but I do have a solid foundation in it that would be reasonably easy to add to, I guess. So that was the PhD. So on paper, I'm already really successful. In here, it just wasn't doing it for me. I saw the future as working in a lab, having to write lots of academic papers or applications for grant funding to do the research that was needed. And I just thought, I don't want to spend my time sitting in an office writing. I get more out of doing practical stuff. But I stuck it for a little while. I'd done a load of teaching during my PhD. That's a very common thing to do here in the UK, is to teach the undergraduate students. And I really enjoyed that. So I got myself into an associate lectureship, bizarrely, in an engineering department at the university. They were offering biomedical type degree, bioengineering sort of thing. But they were their current degree was offering things like the big stuff, the anatomical stuff, like replacement hip and knee joints, things like that. And it was the time when tissue culture was becoming a really interesting thing, and they wanted to get more into the cellular and molecular engineering kind of field. And so I played my little role, a little part in helping that, and wrote half of a brand new degree course, the first year of a brand new degree course, not all of the degree course. And I presented it and examined it, and it was great. And I really loved that because that was hands-on and that was interacting with people instead of with a petri dish. So that was how that bit started. I then had another child, my first daughter, because again, never do one thing at a time. And there's never a right time, is there, to have kids? There's always something going on. But I was then starting to feel, yeah, this is good, and I've got career progression here if I want it. But again, it wasn't fulfilling me at a deep soul level. It was providing the trappings of life, it paid the bills and all the rest of it. But for me as an individual, no. So I made the crazy decision after I'd just fallen pregnant again to apply for medicine, as you do. I got accepted into medicine as a mature student at 39 years young. When I started that course, I was given no grace or credit for time off. I had to start right the way from the beginning, just like everybody else on a 5-year course. But I was also still working in the engineering department part-time. And my third child was born, so my second daughter. And I was still feeding her at 3.5 months old when I started the course. Somewhat a bit bonkers, maybe. Some may say. I don't care. Say that if you like. But yeah, it was a busy time of my life, let's put it that way. And finally, I thought, yeah, this is it. I met a group of incredible people, still friends with some of them today. It was fulfilling for the first few years. So going through med school, you obviously have to decide what you're going to do once you graduate. And you get a couple of years here in the UK doing something called a foundation programme, where you have 3 or 4 month long rotations over 2 years, sometimes 6 months long, and you go through different specialties. So it gives you a nice taster, but you are actually working as a doctor when you're doing that. I knew that I was going to end up in the operating theatres because my very first job, when I was coming out of the rebellious phase, was actually working in the operating theatres as a technician. And my main role there was helping the anaesthetist, even though we did learn how to be what they call a scrub nurse, which is the one that passes the surgeon all the sterile instruments during the operation. And I really liked then the fact that it was included every aspect of working in the theatre. I like to know what's going on, was what I learned from that. But that was when my mum got sick. So that was why I left that and didn't pursue that career. So I kind of knew from that. I tried very, very hard to like general practice because it's good with family. I'd rather stick needles in my eyes. Just not for me. A very necessary role. A lot of my friends are GPs, but no, not for me. So I then just had to make the decision which side of the patient I was going to be on. Was I going to be on the anaesthetic side or the surgical side? And there was a bit of a potential pull towards obstetrics, but it was during a placement in my second year as a qualified doctor in cardiothoracic surgery, of all things, where I was in the theatres, absolutely fascinated by what the surgeons were doing, just mind-blowing, but realised that I wanted to be on the other side.
This episode brought to you by protandemcanada.lifevantage.com. What if you could turn on your body to work like it was supposed to? What if you could have it remember how to handle toxins, stress, and the environment like it used to when you were young? What if it worked for your pets too? What if this is not about supplementing something that is missing, but activating something that has gone dormant? About actually turning on your body to make these things again. Learn how to activate your body now. Check us out, protandemcanada.lifevantage.com.
Side of the screen. That was when the penny dropped. And that was when I applied for anaesthetics, and that's what I've been doing ever since. That only answers the question though, doesn't it?
So now tell us the twist.
So again, anaesthetics, I thought, yeah, this is great. And it was, and it still is. I feel very humbled to be able to do what I do, that people allow me to do what I do with them, the patients. And it's a great privilege. But again, it got to the point where I was like, there's got to be more to it than this. And it felt really, really, really busy and a lot of pressure, which I knew there was going to be because anaesthetists are really well regarded. And we're often the ones in the UK that run the intensive care departments. So there's a dual role. It's not just operating theatres. And we always are involved in calls down to resus, where the really serious emergency cases come into the hospital through the emergency department. So there's lots going on. But 5 years ago, my little brother got really sick. And this was where the twist started. I was already thinking, I'm getting a bit older. I am literally getting physically tired. Something needs to change. And he lived down south, so about sort of 3.5, 4 hours from me. And of course, it was COVID time. And so I was struggling to get down to him. He didn't tell me how sick he was until after the sort of first wave of COVID disappeared. He was very respectful with that. He knew that I was going to be really stressed out and trying to take things on from working on the front line. That sort of headspace dilemma. To cut a long story short, he ended up on an intensive care unit in central London. He was there for 6 weeks with a condition called multiple myeloma, which is bone marrow cancer. He passed on the intensive care unit at the age of 53, was completely cured of his multiple myeloma because he'd been, I'm not going to say athletic, but since he'd survived prostate cancer 10 years previously, he'd been doing a lot of charity running and had gradually built that up for the hospital that had helped him out then. And he was doing these, I don't know if you're familiar with them, half marathon Tough Mudder events, where you go through mud and obstacles and all that crazy stuff. And he was actually admitted to ITU wearing a Tough Mudder half marathon t-shirt. So he wasn't your typical ITU patient. And because of his good functional status prior to getting ill, he almost wasn't taken seriously on the multiple times he presented to the emergency department. 5 times he went there. Twice he was blue lighted in directly from the GP's surgery because they were so concerned about him. And yet he was still sent home. And that was during COVID. So my reasoning behind why he passed was because he didn't get the treatment that he needed earlier on. Had he been seen at his first presentation and they'd done the tests that they would have done had COVID not have been around, I'm absolutely sure he would still be with us today. But while he was there and getting the treatment, I saw that the whole of him wasn't being looked at. I mean, they don't have time. It's not the role of the acute care hospitals to do that. But that was when my awakening started. And I thought, hang on a minute here, what else can I do? What else is there out there? What services could I potentially get in to help him? And so I started looking on the internet. And clearly, I'm not daft. And I was struggling. I was like, well, I've never heard of half of these things. What are they? And you can imagine I'm going down to central London. I'm going out to his house, which is about an hour and 2 train rides and a car drive away. And then I'm coming back up north to work and to look after my own family. And I was doing this circle for about 3 months before he went into hospital. So a total of about 5 months. I was exhausted. And I just thought, well, if I find something that's I think's going to help him, I don't know for sure, for a start, and I certainly don't know if any of these practitioners are any good. So he never got any of that. So after he passed, I thought, I need to do something about this. I need to change this because I cannot be the only person in this situation. And I thought, well, I'm quite uniquely placed in that I am medically qualified, I'm scientifically qualified. I've got a background that can support my endeavours and hopefully give me a bit of credibility. Right, this is what I'm going to do. And my initial thought was just to create a database. So I'm part of quite a big network that's UK based, but it's international. And a lot of the people within this network have some sort of healing background. And I thought, right, these people here are heart-led. I either know them personally or somebody else in the group who I know personally knows them. So they felt relatively easy to check out, if you like, and to be able to give the credibility to that I was looking for. So I started there and started putting all these names together. And then I thought, there needs to be more than this. I want to give these people a voice. This is what my brother would have wanted. Whether he would or not, I don't really know, but that was my take on it. That was my rationale, wanting to create a legacy for him, really. And so I set up my own podcast and started interviewing these people and just wanting to get their names out there. And I was so delighted when a few months in, somebody messaged me back and said, we've started getting clients just from people listening to your podcast. And I was like, yay, this is it. This is wonderful. But as you probably gathered about me, I don't do one thing at a time. So I'm still working in the NHS, but I'd cut my hours down a little bit after that. I really was tired and decided that I wanted to look more into the holistic healing processes that are available. Okay, what can I do now? I thought, well, we get a lot of anxiety and phobias, understandably, people coming into hospital to have operations. And I think it's perfectly normal to feel anxious about that. And some people cope with that better than others. So the first step for me individually was to find some training in clinical hypnotherapy that I could do in my own time at my own cost to help people in these situations. So that's what I did. And I've had some lovely stories. I mean, it doesn't work on everybody. And I don't have much time in, the role of seeing patients pre-op because it's done on the same day. I might get about 10 or 15 minutes if I'm lucky. And then obviously the time in the anaesthetic room when they're actually come down into theatre. But some of the stories, some of the successes have been just beautiful, bring you to tears. And I love that.
So do you think that the surgery goes differently because of the energetic intentions around it?
From what I have seen, people, if they go to sleep more gently and their whole energy is calm, then during the surgery, I don't notice as many fluctuations as I'm monitoring them constantly all the way through. They don't tend to need as much pain relief. And because I forward pace them in a positive way as to, we're looking forward to waking up in recovery. We're looking forward to going home. Depending on the age of the person, you're looking forward to doing whatever it might be afterwards, and healing well. They tend to be more alert and calmer in recovery as well, even the younger ones. The youngest success was on a young man of 12. So I think about him a lot when I'm talking about things like this. And a young lady in her 20s as well who was utterly terrified. And she woke up cheerful, happy, smiling. She goes, I can't believe it. Just the whole energy of the whole event was fabulous. And the added bonus that comes from it is it affects the whole of the theatre team. Everybody now wants to be in my anaesthetic room because it's a positive place. It's not fun, but, we'll have the appropriate level of chatter and banter with the patient, it's all very patient-centred. It's not me doing what I want to do. It's me doing what I'm going to do with the patient included as part of the journey.
So do you see the power of the subconscious differently now?
Oh, absolutely. Absolutely. It's an incredibly powerful thing. Yeah.
Tell us about your...
Don't we?
Yeah. Tell us about, maybe give us an example of one of the situations that you've been in with someone and that you considered an extraordinary power of the subconscious?
So the clinical hypnotherapy I use is very much about suggestion. And I encompass as many of the senses as well, because they all have access to our subconscious. How many of your memories are triggered by certain sounds, smells, a song, whatever it might be? And so if I tell you about my little 12-year-old boy, because it was just a thing of beauty. And obviously he didn't know he was accessing his subconscious. So I think he's another really good example. So he was needle phobic. And obviously I have to put a cannula in to be able to give him the anaesthetic drugs and to keep him safe during the surgery. And that takes one particular technique where I temporarily, through the subconscious, dissociate his hand completely from the rest of his body, so that his mind, his subconscious, isn't even aware that there's anything happening to his hand. And first off, he was a bit nervous about that. But then I was able to put the cannula in and he put his hand up here and went, okay, fine, excellent. Then use a different technique, I could say involving all of his senses where possible. So I'd said to him, I'm very careful about my words as well. I said, I don't use the word safe place, because that could conjure up trauma in somebody's subconscious. So we'll avoid that. So just say a place, where you're going to be happy and full of joy. You can make it up if you want to. It doesn't have to be real, or it can be a real place. I don't mind. And he wanted to be in Dubai watching Juventus. Now, I know nothing about football. So I'm like, okay, this is a challenge, but it's not about me. It's about him. So, and obviously at 12 years old, his mum's in the anaesthetic room as well. And she was involved in everything that was going on from a consent standpoint. And so I asked him, what was it feeling like being there in Dubai? Could he feel the sun on his face? Was it warm? Were there any particular smells that he could get? And at this time, I'm placing the oxygen mask over his nose and mouth. I said, what can you smell? And then I embellished a little story for him to help feed into his subconscious mind. So I said, it's a special trip and you were invited into the changing room when the team were getting ready. I said, so you've heard all the pre-match talk and stuff. I said, and they've given you a football strip to wear. It's the same as what they're going to be wearing. And he's like, oh, yeah. Bearing in mind, he's laid flat on his back in an anaesthetic room. And he's, oh, yeah, that's great. I said, right, come on then. Let's walk up the tunnel. Let's get you pitch side. I says, what can you hear? Can you hear the crowd? He goes, yeah, they're really loud. He goes, it's amazing. They're chanting whatever it was. I says, and the sun, can you feel it on your face? Is it nice and warm? It's not raining, is it? And really getting him to picture where he is so he can hear it, see it, feel it, smell it, all those things that trigger positive vibes in our subconscious minds. And I says, hey, they're coming now, they're coming. And I says, they're all going to high five you as you go past, give you a little nod kind of thing. I says, do you need a drink? It's really hot. He says, yeah, actually, yeah, I do. So what's your favourite? And whatever it was, I don't know. So make sure you get loads of ice in it, because I was preparing him for the bit I knew was coming up. I says, you're going to need that. I says, okay, kick off, here we go. And he's like, I could see him going like this. So he was like watching the match and really enjoying it. And I went, hey, they're going to score. They're going to score. Do you reckon they're going to score? And he's like, yeah. Because I knew that the next second I was going to start injecting through that cannula the medication that would send him off to sleep. And that medication feels a bit cold as it goes up your arm. So I was going to prepare him for that. And I went, oh, goodness me. I said, you're spilling your drink. All that ice is running up your arm as the medication went in. And he turned around and looked at me like this with a look on his face and going, did you know that? And he fell asleep. His mum was in absolute floods of tears behind me. The theatre team were like, that was amazing. And I went, yeah, wasn't it fun?
Wow. So his mom was able to watch the surgery.
I mean, she watched the anaesthetic.
Okay.
Yeah.
Okay.
Yeah.
So tell us this awakening and going to sleep and awakening. Is there a space? Is there that's where magic happens?
Wow, what a question. So officially in anesthesia, there are 4 stages of consciousness, from you and I being fully conscious to me having done what I do in the anaesthetic room and rendering somebody temporarily completely unconscious in a controlled way. So, and you go through two of the stages there, one of which is called a stage of excitation, which is your body's way of going kind of, hang on a minute, what's happening here? And it starts firing on all cylinders, and do I need to be alert to this kind of thing? And then the medications are more powerful and we win, which is clearly the state that you want somebody to be in for anaesthetics. The hope is that I put somebody in a state where they'd have no active memory of anything that happens during the surgery, and they come back through those phases in reverse at the end. But we can also put people into what is termed sedation, which is the stage before the excitation, but not going as far as consciousness, as unconsciousness. And we would liken that to people, even though it's not strictly true in terms of what's going on, but we will explain it to people by saying it's a bit more like being in a really nice deep sleep in your own bed at night. But, I could call your name, go, Melanie, you all right in there? And you go, oh, yeah, fine. Which obviously, if I rendered you completely unconscious, you wouldn't be doing that. So there are definitely stages and spaces in between. Yeah.
So you have taken a little bit more of a holistic approach to this I always have a hard time saying anesthesiology or anesthesiologist. But tell me, have you come up against any barriers or any
always.
obstacles?
Always. I mean, a lot of my peers are like, what are you doing? Isn't that a bit out there? Think what you like. It's on the Royal College of Anaesthetists website that clinical hypnotherapy works. So I'm not the only anaesthetist out there that says it's any good. Apparently, they've done research, and there are a couple of audios actually on that website that are designed specifically for patients who are in varying degrees of consciousness on intensive care. And it helps them wake up quicker and get out of intensive care quicker. So if those people are only interested in the money, it's going to be helping that side too, because their stay on intensive care is shorter. It's a win-win, in my opinion. But I also have stepped out, and one of the things I do outside of work in a business sense is I offer the multivitamin drips and the multi-nutrient drips. So, what's my skill set as an anaesthetist? I stick cannulas in people. So why not do that outside of work? And I am pretty much unique in that. I'm not saying I'm the only doctor that's doing that, but there's not many of us. But as far as I'm aware, in the UK, certainly I'm the only anaesthetist doing it.
Okay.
So I offer a really high precision level of skill to what I'm doing. And I'm not trying to do down anybody else doing it. But I believe there are even some beauticians and people that, have no real clinical qualifications at all able to do this. That frightens me a little bit. I don't think they're in it for the right reasons. I'm in it genuinely to make sure that I can really give best care to these people in a safe environment, so that if anything does go wrong, I know exactly what to do because I do it all day in my day job. I think you are much more in your own vibration if you stick to what you know best and stick to your own zone of genius.
Is there anything that you used to know that you now feel is not true?
That is a really good question. What did I used to know that isn't true? So many things. I think if I go through just life's rich journey, beliefs I used to hold don't sit anymore. Everybody has their own path, and we shouldn't all be judged on what the content of that path is. It's often seen that you have to go through either an academic route, and get loads of certificates to be any good at what you do. I don't think that's necessarily true anymore. Yes, that's what I did, but I still think I'd be really good at hypnotherapy if I hadn't done any of those qualifications. I just think I've been able to apply it through having those.
Yeah.
I think every individual is a genius in their own right at what they do, and we should allow them to do it, because wouldn't the world be a better place if everybody was vibrating at their own highest frequency?
Right. Do you think differently about the educational system now?
Yes. Yeah. 100%.
Ooh.
I have quite strong opinions on the education system that I don't mind sharing, I have to say.
Excellent.
Because people will take what they want from it. I strongly believe there needs to be an education system But I think the current education system, certainly in the UK, I can't speak for anywhere else, isn't fit for purpose in terms of preparing an individual for life after education. I think it prepares people to learn by rote and kills critical thinking and self-analysis. I think it prepares people to pass exams and to either take the route of going into more academia or into the workplace to pay taxes and contribute. That's where I believe that goes. I think education really struggles to provide for people's different learning needs. We don't all learn well by sitting in a classroom. What about those of us that like to be up and about and moving? You get shunned for that in a typical classroom environment. What about those of us that are really, really terrible at learning by rote, but you put them in a practical problem-solving situation? Absolutely smash it. It needs to be more flexible. It needs to be able to encompass different learning styles all the way through and to provide people with life skills so that you can actually know how to live your life as an adult, not just how to pass exams and contribute to the tax system. Told you it was quite polarizing, didn't I?
Well, I agree with all of that.
Hmm.
I'm also starting to really realize the business of education. And, people are coming out with just so much crippling debt, which sets the stage for everything else in their life. And so I feel like, that is a huge part of our education system that is actually systemically harming society. It's this mindset that we have to go into to be somebody. The trades have been devalued. Being practical and doing stuff has been devalued. And a lot of these degrees, these young people are coming out and not being able to apply, not having a place.
Yeah. And that is so wrong. That to me is a huge disservice, not
Yeah.
only to the individual, but to society as a whole, because the trades, we all need tradespeople.
Yes.
We
Yeah.
all live in homes that have, services coming into them that tradespeople are trained to look after.
Yeah.
They should be the pinnacle. They're necessary.
So how would, if you could have this crystal ball of perfection, you could hold it in your hands and spin it so that the education system, the health system was working more cohesively. What would you see some initial steps would be to start rectifying some of these things? Or do you see any solutions?
I've heard quite a bit about forest schools.
Mm.
And I think they're a really good stepping stone in the right direction because kids are allowed to be kids and run round outside, not be afraid of the weather, which I know you get quite extreme weather where you are. We get massively variable weather here in the UK, which is why we're known for talking about it all the time, because you never know from, I was going to say one day to the next then, you never know from 1 minute to the next what's going to be happening. It's common to have all 4 seasons in one day, let's put it that way, so you can't plan anything. But, let's not make a big thing of it. It's not about the weather, it's about having the right clothes. So let's equip these kids to see things like that. Let's equip them to know that, what berries, mushrooms, etc. are safe to eat and what ones aren't, more importantly, probably. Let's equip them to know about nature in all its forms, to know how to grow things, because that leads through your entire life. They can then be more, sustainable, more organic, which is better for us. That's getting into another territory, isn't it, when money's the driver. But also, I think that would give the kids growing up a much better education into life where you could build in all the actual skill sets that you need for being an adult. And then when it comes to healthcare, what is wrong with using the best aspects of modern clinical healthcare with alternative therapies? Why is there such a problem with combining the two? I mean, my opinion, the answer is it's big pharma and the money. But put that aside and just look at it, as a model. There are some hospitals over here in the UK, that mainly orthopaedic private hospitals, that have embraced the fact that something like hyperbaric oxygen has been proven to help healing with fractures. Why can't we just accept that all over? Why does it have to be in a few private hospitals? They're just starting to say now, sound therapy actually helps. Well, yes, it does. We've been saying that for decades in the complementary world. Finally, come on, let's do something about it. And there are many other modalities as well, hypnotherapy obviously being one that's included, that can help. And that is my mission, just a tiny little one, to try and, in the nicest possible way, force that integration to occur so that we as humans can have the best healthcare available. So that when we need acute and critical care, there is a serviceable, functional hospital space that will provide for us. But if we're managing a chronic condition and we're not into the concept of big pharma, or it doesn't seem to be working for us, we should be offered alternatives, because the human body can heal itself in most circumstances if we give it the right conditions to do so. And that starts right from school all the way through to the healthcare provision.
Yes, yes, yes. So you and I have found out, after agreeing to do this podcast, that we have a little bit of some similar interests and activities, you might say. Part of the reason, I'll just preface this by saying, is part of the reason that I called this podcast Activate and Illuminate is because I've spent 10 years bringing this particular cellular activator to market here in Canada and around. And I found out after, we were talking that you also are passionate about that particular activator. So tell us a little bit why you are so passionate about this, and why, as an anesthesiologist, you see such value in it.
So this particular activator, NRF2, activates something in our body called glutathione. Glutathione is one of our body's best antioxidants, and we produce it naturally. But our environment surrounding each and every one of us, no matter where we are in the world, is full of toxins to a different varying degree. A lot of them we can't escape. And glutathione as an antioxidant helps our bodies to fight these toxins. But if we're eating a poor diet, and by that I mean an awful lot of processed foods, because our circumstances dictate we have to, our glutathione supplies are going to be depleted very, very quickly because it's working so hard. So we need to take something, supplement, if we can't get away from the processed diet, for instance, that's going to help our body, a natural something we need to take that's going to help our body make more glutathione. And that's what this NRF2 does. It's a genius plant mixture with things in the right ratios that gets our body to produce its own glutathione. So it goes right back to turning on the genes, activating the genes to produce more of what our body produces naturally. I mean, it's not going to do us any harm. We produce it anyway. And if we deplete, we need more. And it's just going to help us to stay healthier for longer. So it ticks all the boxes for me. I want to promote health. I don't want to come to it all the time like the current model is that you get ill first and we treat it later. I want to go right to the root cause, right to the beginning, and go into prevention.
Well, I couldn't agree more. I've spent the last 10 years seeing how it applies to different people. And when you talk about the root condition and just knowing how many things are connected to eliminating that root condition, it is, to me, it is such an honor to have someone like you also seeing the value in it. So thank you.
Yeah, totally.
So tell me a little bit about the energetics of what you know now, and just some of the, how you see the energetics of, when you talked a little while ago about, maintaining our own vibratory rate and maintaining our own energy. Is there aspects of this that you see being hijacked in our medical system, or is there tools that you see being useful, aside from some of the things that we've already talked about, of just maintaining your own energy in the system that you're participating in?
Yeah, there are things that we have control of within our own bodies. For instance, our breath, and breath work is hugely important and can change your state. And your state, by which I mean your mental state, is the other thing that we can control. It can be really difficult sometimes. I'm not saying that you're changing your own mental health state can be easy, especially if certain beliefs are entrenched. So if you were brought up, for instance, in unfortunate circumstances, whatever they may be, where maybe money's low, your health is low, maybe there are undesirable relationships happening within your family to whatever degree, it's highly likely that as you grow older, you may well be in quite a low vibrational state because that's what you've been surrounded by all the time. But that doesn't mean that you have to stay there. You can change your vibrational state. You can start to try and think of things in a more positive way to raise your own personal frequency. And it may just be being grateful for the tiniest little things in life is a really good place to start. So just be grateful, even if the world you wake up into every morning isn't a nice place to be. Be grateful that you are waking up. Be grateful that you can breathe, and go out and give that gratitude to others as well. Because sharing it, oh my goodness gracious me, that raises your state. And you might not see any immediate effects. You'd have to do this for some time, especially if you've been growing up in that environment for a long time. It's not going to happen overnight, but it is so worth it. And you will feel it. Over time, you will feel it in here. And you will then be able to make more positive, actual changes in your life because you will feel more motivation to be able to do so. And you'll continue to grow in gratitude, and you'll feel the joy building inside of you. So even if life is really tough and throwing a lot of curveballs at you, you won't see them as things that are there to get you down. You'll see them as challenges that you have to rise to, challenges that you are then able to overcome, which will again serve in an upward spiral of increasing your vibrational state. And that to me is one of the most positive ways that I would love to see society moving towards, instead of the current mindset where, if you're down, you're going to stay there. And that's that, which seems to be the way society is at the moment. I genuinely believe, and I've seen, not only in myself, but in others, that it really does not have to be that way. That answers your question.
Yeah. So I had a question when you were talking about the stem cells. So do you, with all the background and the degrees and the studying that you have done, do you see any issues in any of the ethics happening with stem cell research right now?
There will always be people that will have issues with stem cells.
Mm-hmm.
There are two main, when I was studying them many, many years ago, there were two main sources of stem cells. One was from embryos, which clearly has its own minefield, of ethical dilemmas surrounding it. And the other was from tumour cells, a specific type of tumour cell, normally the testicular cells. The particular type are called teratocarcinomas. And terato, I think it's the Greek, means monster. And that was because when they first looked at them, they'd cut open this tumour, and this is a bit grim, and they would see different cell types in there. They would see things that were obviously hair, nails, teeth. And so they realised that these tumour cells were really primitive in cell growth types, in cell development types, is that they could make many different kinds of recognisable human tissues. And so that's one source. But they are a tumour. So there are obvious concerns that at the very high level, people will say, well, you're not putting a cancer into me. Now, clearly it's not as simple as that. That's just glossing over a huge topic at a very high level. But there were certain people. Do you remember Superman, Christopher Reeve, who was involved in a horse riding accident many years ago before he passed? He was publicly known to be looking into nerve stem cells with the mindset of, well, I've got very little left to lose. I've had a really good life. So yes, please.
Right.
Try that out on me, I'm not a healthy individual. Unfortunately, he passed before his wishes for that to be somebody who would be trialing them could be carried out. But wouldn't that have been amazing to see if that could have helped him or others in his situation? So yeah, there are many, many ethical debates, and there always will be. But that was me talking sort of 20 odd years ago. Things will have moved on. The questions now that are being asked with regard to the ethics of the situation, I'm certain will be absolutely different. And I'm not up to speed on the current questions, but I do hope to become so as my career outside of anaesthetics evolves, because I don't want to waste the training and the education that I've had. So stem cells will be something that I'll be looking to investigate and dig deep into in the future. So
tell us, Debs, How would you have a youngster in front of you that's looking for advice on what to do in their life and how to proceed? And what would you say the most important thing is for young people now?
To have dreams and to follow them. If you feel something deeply within your soul, in the pit of your stomach, your gut instinct, if you like, that's telling you that this is right for you and I can do this, go with it, go with it. Even if it ends up being the wrong thing at the end of the day, it will open doors for you that wouldn't have otherwise opened. It will show you places where you may think, I was nearly right, but had I not got from A to B, C, D, E, I wouldn't have found out about F, G, and H. And F, G, and H is where I really want to be. So follow your gut. Have faith in yourself. Be positive. Go forward with love and with joy and gratitude. And you'll find it.
That's beautiful. So I'm going to ask you something. Do you have any big dreams that you haven't verbalized before that you would be willing to share?
Yeah, I do. Here in the UK, there is a famous street in London that celebrities and, nobility, if you like, go to for healthcare. It's called Harley Street. And it's in London, and that's where a lot of all of these alternative therapies happen. Not just in Harley Street, but in London, down south. One huge dream of mine as a northern lass in the UK is to bring all these therapies to people up north, to bring them to the communities around the UK. So to bring Harley Street to your high street holistic style. I want healthcare to be open for all and accessible to all in all the formats that it has, not just the NHS. And I want to be able to provide this as a legacy for not only my children and my grandchildren, but everybody else's too. I want us to be weller as a community, as a society, because I sincerely believe then that if we are fitter and healthier, not just in our bodies, but in our minds and in our outlooks and in our everyday being, that the whole world will be a better place. I don't dream small.
Wow, that is a lofty dream, and I can see it. And I think that's the vision of the future that we're moving to.
I just want to be a little part of it.
Mm-hmm. Well, Dr. Debs, is there anything else that you'd like to share with us today?
I would just like to thank you for your fabulous questions and the opportunity to be able to talk with you today. I've really enjoyed it.
Pleasure is all mine. I appreciate your time and the time, not just your time today, but the time that you've put into learning and your experience and the relevance of where we are right now and just some of the credence that you bring to some of the conversations we're having right now. So thank you.
Thank you.
All right.